Hi, I'm Dr. Kevin Shaw. I'm an orthopedic surgeon with Beacon Orthopedics. Today I wanted to talk about shoulder pain. One of the most common reasons patients come in to see us is for shoulder pain, and two of the reasons are shoulder tendonitis and rotator cuff problems. Rotator cuff problems typically occur in active individuals, but really they can occur in any adult, young adult through older age with any reaching, overhead activity or repetitive activity at work or home. Patients often come in asking, why does my shoulder hurt? And it's typically nothing they've done in particular, and it can be a simple wear and tear type injury. And some of this also occurs because of the nature of the anatomy of the shoulder. The shoulder is built with a bone that's part of our shoulder blade that lives right on top of our shoulder, and we can all feel that right through the skin on top of our shoulder. When we reach and lift, this rotator cuff on the top has to rub underneath the acromion, which is a fixed bone. With friction events and restraint injuries, that tendon can sometimes get irritated and have a tendonitis, which leads to stiffness and pain. And sometimes it can actually pull off the bone, as it's shown here, this little blue mark where the tendon attaches, and that's called a rotator cuff tear. All this leads to the common complaints we hear in the office every single day when patients say, I'm stiff, I'm painful when I reach behind me to get the seatbelt on or getting dressed, it's painful when I sleep on my side at nighttime. With activity modifications, what does that mean? Well, that means you're going to stop overhead reaching, lifting. You're going to maybe take yourself out of an exercise or a sport, or maybe you need light duty at work if you have a heavy job overhead. The next thing we do is some physical therapy and put you on some anti-inflammatory medicines. Sometimes a steroid injection may alleviate a lot of the pain. And that steroid injection is going to go right from the side or the back of your shoulder right into the bursa under that bone I was speaking, called the acromion, so that you can relieve pain. The main way we treat the problem, though, is with physical therapy. Physical therapy is going to restore movement, it's going to help with strength, it's going to actually give you more coordination with the simple reaching and lifting activities you might do in life, so that that acromion bone isn't constantly pushing down on the rotator cuff, causing the ongoing problem. Once that happens, it's amazing how people move better, they stop complaining about the reaching activities, and eventually that pain at nighttime that everyone talks about will go away. So for the patient who's got the rotator cuff tear, typically that does mean surgery, especially if it's a significant tear that's causing some weakness. What happens is we do an arthroscopic shoulder surgery. That typically means being asleep, having some numbing medicine in your arm or shoulder so that you don't feel much afterwards. You make small openings around the shoulder so that the arthroscope can see inside the shoulder joint and around the tendon, and other little openings to pass sutures and put anchors into the bone to reattach the tendon. So what we're doing is usually grabbing this tendon, which is pulled off the bone in many cases, and reattaching it right into the bone. Additionally, we have some tools that shave and sand the edges of the bone so that we give that tendon repair some room. This is typically about a 3-month recovery process. It could be shorter and it could be longer if it's a bigger tear or there's a problem with stiffness or weakness that's unforeseen. The initial treatment after surgery is with a sling. We start therapy almost immediately, and your physical therapist will really guide you through the whole process. Once healing occurs in that 3-month range, patients really can go back to a lot of their normal activities and almost restore a perfectly equal shoulder to their opposite side and really be very happy with how their pain level is and what their function is like. I hope this video answers some questions for you. If you have further questions or more concerns, feel free to call any of us at Beacon Orthopedics, and we're happy to see you.